All right. Thank you so much for having us in this series. I just want to thank you for joining us for our first webinar in our perinatal mental health safety series. Throughout the next few months, we'll be giving you knowledge and tools to better care for our patients and the perinatal population that are experiencing mental health concerns. Through better understanding we can prevent and manage common safety concerns arising in the life stage and reduce the burden of these conditions. We start today by talking about prevention with something as simple as sleep. And in the upcoming webinars, my colleagues will talk about different topics across the spectrum of perinatal mental health. And then we'll conclude with a lecture on recognizing and treating psychiatric crisis. So my topic it seems very simple, but very difficult for moms in this time in their life and families in general in this time in their life. But we'll talk about why it's important to ensure that our patients are getting the sleep they need, and how it can prevent mood worsening or even new onset of mood disorders or anxiety disorders in the perinatal period. So our objectives, I'm just going to do a brief overview of what perinatal mood and anxiety disorders are. We'll learn more about them in the series in the months to come. And then I'll examine the benefits of sleep and why it should be protected. We'll examine the intricate connection between sleep disturbances and the onset of PMADs, and then discuss some strategies. So some simple strategies you can do when you're talking to your patients as they're preparing for childbirth, similar to what we do for birth planning for their wishes during their hospitalization when they're delivering their baby. We can create a postpartum birth plan that will help to set them up for success and prevent any sort of mood worsening. So, AR in general, our perinatal mood and anxiety disorders are just a group of mental health conditions that affect women during pregnancy and in the postpartum period. Each of the conditions meet the DSM-5 criteria for each disorder, but it just happens to occur in the perinatal or postpartum time in their life. So we have postpartum or perinatal depression, characterized by persistent sadness, lack of interest, feelings of hopelessness, and these occur during pregnancy and postpartum. Perinatal anxiety, essentially generalized anxiety disorder that happens to occur in the perinatal or postpartum time period. Perinatal obsessive compulsive disorder, which is marked by intrusive and distressing thoughts and compulsive behaviors often that a woman experiences in that time in her life. And then PTSD, whether it's related to her pregnancy experience or birth experience, postpartum experience, postpartum PTSD. And then, of course, we touch on postpartum psychosis, and this will be also a part of the discussion later on in the series. A rare but very, very serious condition that often requires hospitalization. That includes psychotic symptoms like hallucinations, delusions, severe mood swings, and can occur pretty quickly in the first couple of weeks postpartum. We know that they can impact a mother's ability to function and bond with their baby. So early detection and intervention and even prevention is just so crucial for taking care of these patients. And then some risk with untreated PMADs, and this will be again discussed in further detail. But maternal risk, we see a decreased compliance with prenatal care, so inconsistent care or not having care at all, increased risk of preeclampsia, gestational diabetes, difficulty with relationships or increased conflicts because of irritability or because of the mood symptoms themselves. Overall health concerns, so added stress and strain can further affect their mental health. Unintentional overdose, if they're not caring well for themselves, increased substance use, and increased risk of suicide. And then for the baby, we have increased risk of preterm delivery and low birth weight, may see adverse neurodevelopmental outcomes, developmental delays, and untreated PMADs, and then behavioral issues and potential for psychiatric illnesses as they age. All right, on to the next objective. which is the benefits of sleep and why it should be protected. It seems like a simple um, topic, but in researching it, I found it interesting that in when we had to protect ourselves from before we were a civilized society, sleep where you're so defenseless, it still takes up a big part of your day, and you have to be in that. This is so important for sleep, even though when you are asleep, you're defenseless against, animals and things when we think about before we're civilized. So it was interesting to read the progression of finding out why sleep is so important despite our um, ability to not protect ourselves. So sleep in general improves our attention. So when we're well rested, our focus and concentration are enhanced. We can perform tasks more efficiently. It strengthens our memory. So adequate sleep helps us to remember and recall information better. It's crucial for everyday activities and for learning. It aids in our decision making. So we can make better and more accurate decisions with our cognitive functions when they are operating optimally. Enhances problem solving abilities. When we get enough sleep, we're able to be better equipped to tackle complex problems and find effective solutions. Um, It boosts learning, so our ability to learn and retain new information, making it easier to acquire new skills, fosters creativity, um, encourages creative thinking and innovation, and helps with emotional regulation. So um, the ability to manage and regulate our emotions more effectively. As you can see, those are all really important for a parent in the first few months, being able to function well and all of those topics there. And as far as physical health benefits, it helps with repairing the heart, blood vessels, helps with hormone regulation related to hunger. So it helps to manage hormones like leptin and ghrelin, and which helps control hunger and appetite. Um, it helps to manage insulin and glucose regulation and improves the immune system, and helps prevent risk long term, like heart disease and obesity down the line. So why is it so important, especially for our parents and our moms? Promotes healing. Physical recovery from childbirth often can be a grueling experience, both physically and mentally. Often don't get enough sleep during that time. So promoting tissue repair and essential for regaining strength and health. Helps restore energy, and which is very important for meeting the demands of and caring for a newborn. Gives us the stamina we need. Mood stability helps reduce risk of mood swings, irritability, emotional volatility. It's crucial for maintaining a calm and positive environment for taking care and raising your kids. Prevents depression, lowers risk of perinatal depression. Ensuring adequate rest can be a significant factor in preventing perinatal worsening or onset of depression. Can help with um, focus and attention. Like you've already talked about being alert, making appropriate decisions for your family and for your child. Helps reduce errors. um, Say like you have to give your baby medication, ensuring that we are measuring the proper amount. So that's a really big safety factor there when we're talking about decision making and things like that. Emotional availability for our moms. So well-rested moms can be more emotionally available and responsive to their babies, fostering better bonding and a stronger emotional connection. Um, can provide better care to others when we are taking care of ourselves, and then immune system support and overall just well-being. All right. So when we talk about sleep, a lot of times I hear when I ask my new parents how they're sleeping, they'll say, "Well, I got about 6 hours, but we were up every two." So their sleep that they're counting is 6 to 8 hours, but it's, every 2 hours they're waking up. So looking at the difference between consolidated sleep and fragmented sleep. So, as far as sleep architecture and restoration, consolidated sleep promotes uninterrupted progression through the sleep stages. So, if you think about the different stages of sleep and the importance of each one, especially REM sleep, that is essential for cognitive functions like memory consolidation, emotional regulation, and physical restoration. Whereas with fragmented sleep, it disrupts that architecture, reducing the time spent in those critical sleep stages and then leads to incomplete restorative processes. And then, as far as cognitive performance, consolidated sleep enhances that, including memory, attention, executive function. Whereas in fragmented sleep, even if the total is the same, as your consolidated sleep, the frequent awakenings impair cognitive function and increase fatigue and poor concentration. And then for your physical health and overall well-being, consolidated sleep leads to better overall physical health, reduce fatigue, and increase daytime alertness, whereas fragmented sleep increases daytime fatigue, decreases overall alertness, and can contribute to long-term health issues. Right, and on to our next objective. So, what is the connection between sleep and the onset of PMADs? I really like this quote. It's in the textbook of Women's Reproductive Mental Health. Sleep is the most critical self-care issue a new parent faces, and arguably the most important modifiable risk factor for postpartum psychiatric disorders. And we talk about non-modifiable risk factors, like we literally cannot do anything for them. But this one is a very simple one. If we can just provide education and a means for sleep, it can help to reduce the risk of these psychiatric disorders. So what happens to the body without adequate sleep? You have decreased performance in goal-directed activities. So when we don't get enough sleep, our attention and focus are significantly reduced. The impairment makes it harder to achieve our goals effectively, whether in work, school, daily tasks, caring for our kids. There's sleep deprivation leads to a lower functional MRI signals in crucial areas of the brain, like the dorsolateral prefrontal cortex and then the interparietal sulcus, especially during attentional tasks. So these are essential for higher cognitive functions, and their reduced activity impacts our mental efficiency. And we have difficulty in retaining and manipulating information. Without significant sleep, we struggle to hold and process information. And the difficulty affects our ability to perform tasks and can impact everything from simple complication or calculations to a complex problem-solving issue. Lack of sleep reliably triggers changes in our emotional processing. We can become more irritable, emotionally volatile, anxious, and even aggressive. I hear that often from my parents that aren't sleeping well, that they don't know who they are. They feel like this irritability in them is they've never seen it before. They can't understand why they're snapping at their partner like they are. This can cause strain to relationships and reduced overall quality of life. It can cause significantly increases the risk of suicidal thoughts and ideations, attempts, and completion. This is a serious consequence and underscores the importance of prioritizing sleep. And then, of course, we have already alluded to it, higher incidence of psychiatric disorders. So a clear connection between sleep deprivation and a higher incidence of disorders like depression and anxiety in the general population. And it's well documented, especially for those with a history of bipolar disorder, even outside the context of postpartum or perinatal uh, process in life. Sleep deprivation can trigger manic episodes in an individual with bipolar disorder. So again, some more consequences of sleep deficit. So in general, it decreases or increases the risk of chronic illness and mortality. So for the general population, not even looking at pregnancy, postpartum, it is associated with increased risks of heart disease, diabetes, weakened immune function, and then ultimately impacts the overall longevity and quality of life. In the postpartum population, it increases the risk of depression, anxiety, and emotional dysregulation, interpersonal conflicts, and suicidal ideation. And don't forget about safety. So there have been a lot of studies that show sleep deprivation is just as dangerous as driving while intoxicated. So after 14 days of restricted sleep, so less than 6 hours per day, significant and cumulative deficits in cognition are present. And keeping someone awake for 19 hours impairs their speed, accuracy, and hand-eye coordination on the task at the same level of a blood alcohol level concentration of zero point 0.1. So with 0.08 being enough to be to get a DUI in most states. I think about how many, as a labor nurse, how many patients of mine that were up way longer than 18 hours in labor. So another slide that reviews the rest. So poor sleep quality was significantly associated with anxiety and depression at 6 months postpartum, and that's a bidirectional association. So those with postpartum or with depression, anxiety had significantly worse sleep as well as sleep caused anxiety and depression. So it can go both directions. During pregnancy, they had a 3.72 times higher risk of antenatal depression when there was issues with sleep, and then postpartum 2.7. A big safety concern is and with our moms with a history of bipolar disorder. There's a significant risk factor for developing postpartum psychosis, and several newer studies just came out this year showing that missing just one night of sleep during labor or early postpartum while they're still in the hospital can increase the risk of postpartum psychosis by 5 times. And so that is a simple, intervention we can do right there in the hospital, where they are staffed to help take care of their baby. There are medications available for sleep if needed, that kind of thing. So it's a really important thing to know and to make sure you're knowing, your patient's risks when they are going in labor. All right. And our last objective is the what we can do about it. So discussing strategies for prescribing sleep and preventative measures against PMADs. So first, I even thought this when my babies were little. They're older now, but they're worth the sacrifice. Of course, we feel like they're worth the sacrifice, but is it truly? So when we think about the reality of constant caregiving, parents often prioritize their children's needs over their own, which can lead to neglect on their own well-being. While it's natural to focus on our kids, it's crucial to recognize the impact of our own health when we don't take care of ourselves. Lack of self-care is a common issue. Parents frequently sacrifice sleep, their personal time, and their health to ensure that their kids are well cared for. While this might seem necessary, it can have serious consequences. The emotional and physical toll of neglecting self-care can be significant. Chronic stress, fatigue, and potential health issues arise from not addressing our own needs. These problems can affect our ability to care for our children effectively. I am thinking about, you may have heard this analogy before, thinking about the airplane safety rule. Put on your own oxygen mask before assisting others. It's the same thing with sleep. You have to take care of yourself before you're able to take care of your kids. And then sustainable caregiving is the goal. So by maintaining our health, we can offer better, sustained care for our children. It's not about being selfish. It's about being strong and capable caregivers. Self-care is not selfish. And I think it's important for our patients to hear that. Often prioritizing our own needs ensures that we're in the best condition to care for our children. It's an investment in their well-being as much as it is in our own. So that's an important thing to remember too. And then modeling healthy behavior to them. If you think about what you would want for them as they grow, you want them to know how to take care of themselves and to prioritize their needs. and looking after their own well-being. So being a good example for your own kids. So how can we implement this into practice? So most practices in my area are already doing this. I'm sure throughout the state are as well, but I'm screening for anxiety and depression during pregnancy and then postpartum as well. ACOG has some recommendations for when that should be done. Discussing sleep hygiene, implementing sleep protection measures. And so I have an example coming up of how I talk about some sleep protection measures, and we'll go over that in more detail. Um, but it might involve, having specific strategies for improving sleep quality, like a bedtime routine, making sure there's no external sounds, lights, interruptions during sleep, make sure everyone's on the same page at home. And then you can make a plan. So invite your partners or caregivers to join a visit. It takes a few extra minutes, but it's really worth it when you think about how much prevention is going on in just a few minutes of discussing this. You can have, pre-written instructions or education provided, and then you can discuss what your patient's sleep expectations are. We hear so much expectation from, family and friends around us, like you'll never sleep again, and enjoy it while you last. And so, really discussing like what their expectations are, what they expect to happen when their baby's here, and kind of get an idea where they're starting. And so before they deliver, just like you do um, a delivery plan, or um, consider a postpartum plan as well. So invite the partners to be a part of the planning, whether you do it with the patient in the office, or the parent partner comes to the office, or is and joins by telehealth if they're working, or if you just send information home with the patient. Include them, because often partners don't know what the mom may need if they don't ask, or if they're not told. So it's important to include them in part of the education and planning process. Include specifics, so details of steps you'll use to promote good sleep, such as setting up a sleep-friendly environment and establishing routine. So, if making sure that screens are turned off, there's not a TV going in the room is cool and dark, or you have earplugs, whatever, to help promote that, and an evening routine that is helpful for sleep. So adding in, instead of scrolling through screens or watching a scary movie, having some quiet time, that kind of thing for each person. Ask ahead of time for help. So see, encourage the patient to ask family, friends, partner, who would be available, who would be willing to help during the night or during the day, so that the family, the partner, or the mom can sleep. Um, in our area, we have several postpartum doulas groups, and so consider hired help if they don't have a lot of family, or they are new to the area, don't have friends. Consider looking into postpartum doula that can come in and provide that hands-on support for them. Encourage flexibility in feeding plans, or just assess their feeding plans. What does mom plan to breastfeed? Does she plan to exclusively pump? Does she plan to formula feed, or a combination? So determine what feeding plan she has in place, and encourage flexibility, so that maybe she'll get to sleep through one or two of the feedings, and the partner can feed pumped milk, or a supplement formula, whatever she feels comfortable with. Again, is cannot stress enough monitoring sleep practices and sleep hygiene, ensuring that the room is quiet. You minimize disruption. So even like older kids, ensuring that they're taken care of so they're not interrupting sleep for the person that should be sleeping. Avoid screens, and even consider separate rooms for a period of time. And then during pregnancy and postpartum, treat insomnia. So if baby's sleeping, the house is quiet, and mom cannot sleep, that needs to be addressed. So for mild to moderate insomnia, cognitive behavioral therapy for insomnia is a great choice if you have a provider in the area that can provide that service. And then for severe insomnia, of course, needs to be evaluated for another concern medication management or ensure that it's not something like a manic episode that's going on. And then be flexible. Avoid the rigidity in sleep planning. So it shouldn't be cookie cutter. It should be based on that individual family's needs and what will work from them. It may be that the partner has to go back to work after a week and works night shift, and so there is not anyone home with them. So encouraging them to think outside the box. When can you get sleep? Who can you employ for help? Encourage the same shift for sleep, and it'll make more sense when I go to my next slide with my handout. But instead of switching shifts, like the mom takes the first shift from 8 to 2, and the partner takes the shift from 2 to 8. Don't switch back and forth, because that would be like switching back from nights and days. So staying on that consistent sleep schedule, and then emphasizing sleep hygiene. So this is an example of what I hand out during my postpartum planning with my patients. And so this is just like an example, so they can see physically what I'm trying to talk to them about blocked hours. The gold standard is 6 hours, but we got to meet the patients where they are and do the best that we can with what they're able to do. So if you, in a perfect world, if you had between 8 p.m. and 8 a.m. for 2 people to get sleep, this is what blocked time would look like. So for the first block of time, mom would go to bed at 8 p.m. She would be in a quiet room all by herself, so she cannot hear baby crying or any other kids. Might have eye mask on, earplugs, or sound machine, whatever she needs to keep that room separate, that quiet space separate. And then this is the time for the partner or the doula or whoever, family member or friend that has agreed to help will be taking care of the baby. Now, they can sleep during this time if baby's sleeping, but they are in charge of baby care, feeding, changing, rocking back to sleep, getting back settled in bed. And then it switches. So that happens until 2 a.m. And maybe that the partner brings the baby into the room where mom was sleeping, and he or she takes over sleep time and goes in their quiet space, earplugs, eye mask, sound machine, whatever they need, and gets that second block of 6 hours of sleep. Sometimes you have to be creative. So if mom is really wants to exclusively breastfeed, you may consider teaching dad or partner how to help mom to latch baby on while she's still sort of sleeping. So maybe side lying, and she continues to like keep her eyes closed and do the best she can to still rest through it. And dad may support baby, help baby get latched on, take care of burping, changing sides, and then mom can sleep as well as possible during that time. It may be that she pumps ahead of time for 1 or 2 feedings and has that available for the partner to feed during her sleep time, or if she is flexible with supplementing too, that's also an option. So just meeting the patients where they are and what they want to do as far as their feeding. And it's really important for our patients that are high risk. So maybe they have a history of postpartum psychosis, or they have, a history of bipolar disorder, and they've had frequent manic episodes that maybe during night that they protect against any of the sleep disruptions for that chunk of time, and they do either just pumped or just formula fed. So this is an example. And then if I can, I don't know if people can answer or in the chat, I figured we could do some practice. Let me see. So the case is a 28-year-old G1P0 who presents at 37 weeks for her routine visit. She has a history of bipolar disorder and is under the care of her psychiatric prescriber and therapist. Her partner accompanies her today and discusses her postpartum planning. So first, what are some initial questions you want to know about her current treatment and condition? And Tiffany, I don't know if people can chat, or let me see.
Yes, the chat is open, so please feel free to engage in the chat. Dr. Dechant, would you also be open to folks who might want to just come off mute and
Yeah,
respond? Yeah,
yeah,
so either
absolutely.
is it's fine.
Yep. So I
And
have
it's,
our results.
go on, you can go
Yeah.
ahead.
How is she doing and feeling? So exactly. So how well are her symptoms managed right now? Is she on medication treatment right now? Is she compliant with her medication? When was the last time she had a depressive or a manic episode? So really, how is she doing? Is a great answer. Yeah. Second, what strategies can be implemented to ensure the patient gets adequate sleep postpartum?
I think you can just come on off mute, Esneth. I hope I'm
Oh,
saying your name correctly.
yes, you are. Hi. Rather than type, it's just better to talk. Yeah, I guess find out how her, or I guess what her sleep pattern is now, to kind of get a sense of how she's doing with her sleep and try to also get a sense of what other supports she has in addition to her partner. I guess the question, I guess using those open-ended questions to really see what she's thinking of, to better understand your current situation, and then maybe provide some, education and guidance as to what other solutions she can implement in her plan, whatever plan that she has.
Yes, perfect. Yeah. So getting an idea, is she sleeping right now? Do we need to have her referred back to her provider, her psychiatric provider? Is she having trouble, need medication adjustments? And then, yes, employ help of family, friends, postpartum doula, whatever support she can have, see who she feels comfortable with, and whatever fits into their family, and to help ensure she gets that adequate sleep. How would you counsel this patient regarding infant feeding, knowing her history of bipolar disorder?
Um, I guess find out if she's interested in breastfeeding, bottle feeding, which could either be breast milk or formula feeding. Get a sense of where she's at there. And
Mhm.
from there, you can counsel how she can either get support. Is she okay with supplementing? So if during the nighttime, if she wanted to sleep, she's okay with having her, is it partner or husband or, yeah, partner, is able to, I guess, run the night shift with formula or bottle feeding of breast milk. So again, just asking those questions with what she would prefer.
Absolutely.
Okay.
Yeah, yeah. And again, meeting them where they are, but counseling that, the risks are slightly higher. So it's really important um, to counsel her about her importance of sleep protection, and getting that. Let's see how in the chat
I
can.
was also going to say, would it be important for the partner to just educate on signs and symptoms to monitor for?
Mm-hmm. Yep. And then in the chat, I said, considering the importance of continuing lactation, evaluate the sleeping arrangements for the newborn and the ability to be able to pump. Yeah. There's lots that goes into that. It can be very complex, especially if there's any sort of issues with feeding or weight gain or jaundice with baby and having to do the triple feed I often hear about. So, but just knowing for both the mom and partner that she does have slightly higher risk, so it's really important to evaluate that and make sure that she is getting adequate sleep to help prevent mood worsening. And then the last one, what education should be provided for mood monitoring? So, of course, we'll talk about this later on in our series about mood worsening and what the risks are, especially for someone with bipolar disorder, but it doesn't even have any thoughts about how the patient and the partner could be educated or counseled on what to look out for mood worsening. Yep, so tracking mood, educate what to look out for. So especially for bipolar disorder, a big mood shift in the first few days, or um, onset of psychotic symptoms like delusions, hallucinations, difficulty sleeping when the house is quiet, the baby's sleeping, um, and bizarre behaviors, all kinds of things to look out for. So it's really important to provide that education, especially in this case, for someone with a history of bipolar disorder, that we want them to stay well, and to also make sure they have a plan for who they're going to check in with if something changes. Do they have care with their psychiatric provider, prescriber, scheduled? Is there a close follow-up within the first few days or week after delivery? And who's going to be keeping an eye on that there, making sure medications are in order. All right. And this is a QR code to my postpartum document that I use, that I'm happy to share with anyone that would like to use it in their practice. It goes through, planning meals and planning who is your support person, both like for physical means and for emotional means, and who can you trust to talk to if something doesn't feel right, or who do you contact? So if anyone wants to use it, I'm happy to share. And that is it.
Thank you, Dr. Dechant. I really enjoyed this, and I think a lot of people here did too. I just wanted to give one more try. I don't see any questions in the Q&A or in the chat that weren't already. Just maybe one question from Lori. Why is this not discussed during postpartum stay, along with the information regarding safe sleep practices for the newborn?
Yes, that's a good question. I would love to know. I think it should be. I think it should be implemented into our normal like OB care, and then certainly postpartum, and even our local hospital here is actually working on an initiative to help reduce interruptions during the nights, because we have, our nurses have the legal a requirement for hourly checks for our newborns and moms. And so every time that door opens, whether they have to wake mom up or not, she's awake. Or, unbundling baby and getting blood work, and then, it's 4 a.m. and mom's awake. So they are working on implementing some new protocols for ensuring, like, even something as simple as putting weather stripping on the doors so it's quiet when you open and close it. So little things like that can really be implemented to help from the beginning set them up for success. So yeah, I would love for it to be implemented in routine OB care. It shouldn't just be moms that have risk factors. It should be every mom should get sleep.
A question that I have is, have you seen this work very well, or and I really like your blocking model, but has it worked well with, or do you have to adapt it a little for partners that work, like maybe they work shift work, or they are just they need sleep because they have to get up very early, or those types of factors kind of play?
Yeah, it is hard when the partners work off shift. So if they work night shift, that's going to have to be where it's adapted, where they find other help if they're able to. If they work where they have to get up at 2 a.m., it may be that they go to bed really early. That partner that has to get up early and takes that first sleep shift or the second sleep shift, but starts way earlier and adapt and like shifting that whole hour, 12-hour block back. Or they take that first like 8 to 2, they get up at 2 and then mom takes over from 2 to 8. So depending on what time they have to get, but there it has to be flexible. And that's just an example that it's possible for both to get 6. And the general consensus is 6 hours of sleep, consolidated sleep is really enough to function and to do well and to feel well.
Okay.
Yeah.
Last call. Are there any other questions for Dr. Dechant? Feel free to come off mute if you have them or type them in the chat.
Yeah, I have a question, and thank you for your presentation. Sleep, sleep, sleep. I feel like I learned something just for myself with 2 young children, and 6 hours, I'm not getting that. But my question is, I had a client that I case managed, and she had, oh my gosh, I think she had 5 kids of varied ages. And I think it was 5 or 6, I don't know. And she had issues with substance use as well. And the concern was she was really using to keep her awake because she's just so tired. She can't sleep. She has to take care of the 1-year-old, the newborn, and her other kids that have to take the school bus and whatnot. So she just struggled because she just did not have the time to sleep by the time she has to make dinner by the time they get home. So she just had a lot going on. Partner was not in the picture. She had other stressors in her life. And just back to one of your first slides when you talked about substance use, and this was just, I guess, that classic case. She had substance use, mental health, other competing issues here. So I wonder how does prescribing sleep to somebody that I know that she needs sleep, she verbalizes it, but she just doesn't have the time to sleep.
Yeah, it is really hard. And so there's a lot of resources I found in the last few months about helping with, especially if there's a 1-year-old. I know kids' sleep is so unpredictable. And so it's so hard when you're a single parent. If she has the ability to use a doula or to have family members come stay with her or have, a mother's helper, someone to help. And I know with the issue of finances, it's a whole different thing. And it's almost doesn't seem fair. Like this should be a basic need that's being met. But I have seen some um, resources around for like sleep, not necessarily sleep training in the way of like crying out and all that stuff, but seeing what's going on with like your older kids, why they're not sleeping well, helping them to sleep better so that parents can sleep better. So whatever resources you can find that are available to help get the sleep, and then figuring out what is the reason for her not sleeping. Is she staying awake because the baby's awake, or is she getting the kids to bed, staying up for a couple hours because she feels like she needs to unwind? And then by the time she gets to bed, the baby wakes up and then she can't get back to sleep. So making sure that she doesn't have insomnia on top of that. But it's such a hard thing when you have single parents, and it's so common, and struggling, especially in our economy that we have now, and to add something else to their plate. But it's so important when you think about, I mean, the implications of her lack of sleep, now substance abuse and mental health, that it's worth the time, it's worth the money, it's worth whatever needs to be done to make sure they get sleep.
There's a question in the chat. Will Medicaid/Medicare and other insurances pay for postpartum doulas?
So my understanding is Virginia is one of the only states where postpartum doulas are covered with insurance. I'm not sure about Medicare, but I
Medicaid
know that
does.
yes, Medicaid does, yeah, which is amazing. And I'm so glad that our state has that. So it's really
Mhm.
like most of my parents had never even heard of it. So getting that information out so we can support the doulas so that they can continue to provide services and be more common.
And TRICARE, Beverly said TRICARE as well.
Awesome. Love it.
And I do know recently the number of doulas is slowly increasing in Virginia because they just launched a community-based training center. And so, yeah, I just talked to a doula who just finished her certification. So the number is slowly increasing in the state as well to make that more available.
That's amazing.
Any other questions? All right, well, thank you all for joining us. Thank you again, Dr. Dechant, for sharing this presentation. It was very, very valuable, and thank you for your time. Come back for the next part of our perinatal mental health safety series. And if you would like to see this again or share it with someone, it'll be posted to our YouTube page. Give us about a week or so. We usually have it up for folks to view and to share. So thank you again, everyone. And Dr. Dechant, just hang back for a couple minutes for me. We wish you a very good day, and thank you. See you next time.